The gluten-free movement has definitely gotten out of hand, but there are several health conditions that are seriously affected by gluten intake. Is an underactive thyroid one of them? If you have an autoimmune-related underactive thyroid, aka Hashimoto's disease, then you could be sensitive to gluten. The problem is that the immune system mistakenly attacks and damages the thyroid gland instead of the gluten that you consumed, and this is really characteristic of Hashimoto's disease. In fact, studies show that around 16% of those with celiac disease have antibodies that attack the thyroid. Going by this theory then, an individual with Hashimoto's is at greater risk of damage if gluten is not removed from their diet. Many studies have found that a gluten-free diet reduces the number of anti-thyroid antibodies, which is favourable for treatment and preventing new issues. However, there are also good studies that found no improvement. So it would be reaching to say that gluten definitely aggravates an underactive thyroid, but at the same time, it could very well play a part. The honest truth is, researchers don't know. What we do know is that countless underactive thyroid patients swear by a gluten-free diet. Therefore, if you have an underactive thyroid, the first and most important thing you do is get tested for celiac disease. And if you have a family history of autoimmune disease, or you are struggling to manage symptoms despite working with your doctor for the optimal thyroid medication dosage, then I recommend eliminating gluten from your diet. Gluten-containing foods don't offer any unique nutrients that you can't get from other food sources anyway. If you don't have any symptoms to eating gluten, and you don't feel any different on a strict gluten-free diet, then it's probably not a problem for you. You need to weigh up the social aspect versus the health impact and go from there. We're all different.